Well, I think Kaylee can attest that when you're pregnant, it's a little tricky trying to figure out what medicine you're allowed to take. You want to keep your baby safe, but if you get sick during the pregnancy, it's crazy. You don't know what to do. So Lupe Cruz is here. She is a certified nurse midwife from LDS Hospital. Thanks for being here and kind of letting us know what over-the-counter medicines we can take. So let's talk about this. Let's jump right into it.
So most providers would agree that you probably should steer clear of most things in that first 12 weeks. That first trimester, everything's kind of building, the organs and everything, and so you want to be really careful not to try to avoid things as much as you can, any medication. After the 12 weeks, then you're a little bit better off to be taking medications.
Which is sometimes hard, though. That's when I find it the hardest, because that's when I'm usually the sickest, is like the first 12 weeks is where you're like, I need some kind of relief. You know, I'm 16 weeks now, and I'm like, okay, now I'm starting to feel good. Now my body's starting to feel a little bit normal. I'm getting energy back, so... Yeah, the first 12 weeks are hard. So
you're talking about like nausea and vomiting.
Yeah, queasy.
Yeah, there are Unisom and B6. You probably heard about those combinations that help. If that doesn't help, they have formulated one that is a prescription that your provider can give you a prescription for, and that really helps. But that, again, that's prescription. It's not over the counter. But drinking plenty of fluids is really good. Putting flavors in your fluids, like lemon slices, a handful of frozen strawberries, things like that, rather than the sweet stuff. Like, you know, that way water kind of has a funny taste that first trimester, so you want to put those fruity flavors in them with natural fruits, and it really helps.
That's such a good tip to be able to do that. Now, I think it's funny because there are so many things with pregnancy that you need medicine for, or you feel like that are caused by the pregnancy. Headaches, back pain, things like that. What would you recommend for someone who's pregnant to take to help with those issues?
Those kinds of things, you want to stick with Tylenol. If your pain is so severe that you feel like you need more than Tylenol, then you need to go to your provider. There can be, like I said, prescription medications that you can get, but we like for you to stick with the Tylenol.
Yeah, I always hear to avoid ibuprofen. Why is that?
It's not good for your liver, and it's not good for your baby. So.
Oh, that's so good to know. Okay, so you've got those ailments coming with pregnancy, but do you get allergies at all? Are you okay for spring?
I think I'll be good. I get itchy legs when I'm pregnant, so I'm like, I don't think that has to do with allergies,
But it's something, I mean, it's something annoying that you're dealing with pregnancy and something you're maybe wanting medication for. Oh, yeah. What do you do for allergies?
For allergies, so you can take things like Benadryl, Claritin works really well too. Some of those things you can take, those are the over-the-counter medications for the congestion, the stuffiness that you get, or the runny, itchy, watery eyes, that kind of thing. For the creams, you can do like a hydrocortisone. So you can use that, or also just keeping you know, lotion, cocoa butter lotion, that kind of thing helps to keep your skin moist, because it's kind of, especially in the belly, it's stretching, so you get all that itchiness.
Yes.
What about colds and coughs? I'm hoping we're kind of getting out of that season, but for pregnancy, what are you supposed to do?
Right. So you want to stick with things that are more individual. Don't get the all-inclusive cold and flu medicine, because they have different ingredients in them, so you want to be really careful with that. So Robitussin, the cough, it'll say DM. Those are the good ones to take, the Robitussin. So you want to stay away from the multi-symptom medications.
That's an important thing to do. Okay, another thing that a lot of us get with pregnancy is heartburn. What's something you can do for heartburn?
Right, so Tums is good, Mylanta, those are really good. Stay away from really spicy foods. That's my first suggestion. I know it's hard sometimes when you're craving those things. If you're going to do that, I would say Tums is a really good one, Mylanta.
Well, one last question with that. When you're really wanting to get that baby out at the end, don't they say maybe get some spicy foods? Is that when you should get it?
They do say that. Some people it works for them, and other people just makes them sick. So, yeah, I think baby comes when they're ready to come.
Yeah, baby comes. Well, hopefully baby's not coming for a while for you.
Not for a while.
But so excited. Thank you so much, Lupe, for being here. For more information, a list of all the medicines that are good when you're pregnant, go to ldshospital.org/healthyliving. We're going to link them from our website. And hey, Brian, what's coming up next?